So this is part 2 of the video that we were talking about yesterday with having our patients record their eye movements during attacks. These are the tough patients that you normally would be able to see nystagmus. We use fixation block technology. You can normally see what's going on with them. But these are patients that when they have attacks, they don't have them in your clinic. You try to reproduce them any way you can so you can try to see what the cause of the attacks are, but you just can't seem to do it. And so what we do is we use the video camera. We have the patients hold the camera lens. I try to have them look through the camera, and I'll have them hold the camera straight ahead this way while they're trying to look out in the distance. And then I'll have them hold it for about 10 to 15 seconds here. And I have them look just a little bit to the left for about 10 to 15 seconds. And then I have them look just a little bit to the right for about 10 to 15 seconds. And what I have found is that during attacks, if the attacks are from a vestibular problem, we will see nystagmus. So we will capture nystagmus during the intense attacks, which then allows us to determine if this is peripheral or nystagmus. How do we do that? Peripheral or central nystagmus. So how do we do that? We look at the direction of the nystagmus, the duration of the nystagmus, whether it changes directions, kind of its behavior, whether it can be triggered. Sometimes I might even have the patient lay down and hold the camera on their eyes, might have them roll over. I'm just trying to get them to provoke the attack while they are dizzy. The reason I'm here showing you this is because I always get inspired when I get a chance to get away. I believe my job is my mission, and so I'm always trying to explore and how can we help our patients who are not feeling well. It's not about me. And so but when I come to a place like this and you see new land, it's inspiring, and I try to put together what I'm learning on my trips with what's happening in my life back home. And this is kind of what happens when you test patients in a situation where they normally aren't tested. So we normally haven't tested them during severe attacks. It lets you capture information and see things that you wouldn't have seen before. And so far, the majority of my patients, we see the nystagmus, we can identify it. We've been able to find people who have Meniere's, who are having migraine-related vertigo, who have BPPV, but there are some patients that have patterns of nystagmus that look peripheral, meaning they look like it's from the inner ear, but we know from research that there are some central problems that can mimic that. And so what I'm learning is we're capturing this data very quickly in a way that it's normally not captured, and that means that there's got to be very good teamwork with the doctors. I'm a physical therapist, I'm not a medical doctor, so I'm limited in what I can do with my testing. So there has to be good communication, good teamwork, and then sometimes, you know, all the tests after you capture all this data, you still come back and you're not 100% sure of what's going on. And so we'll throw, we'll talk about what we do about that in another video. But the point is, it's exciting to explore new lands in the vestibular world. We're kind of like pioneers because we're using technology that wasn't ever available. We're learning patterns of nystagmus and kind of triggers and timing and the way people describe their problems in ways that it hasn't been organized in the past. So I hope as you continue in your progression and helping people who are dizzy, that these videos kind of give you some encouragement or a sense of that you're not alone if you're trying some of these things. And may we continue to explore, dream, and discover as we help our clients with dizziness.